And this week on the Ask Dr. Mather show, we're talking about different types of ailments people experience besides back pain. Dr. Mather, you see them all, but it goes beyond just the back.
Yes, being a sports clinic, we see a lot of different types of injuries besides back pain. One of the areas that we specialize in is treatment to the shoulder, which a lot of people don't realize. But we see a lot of shoulder pain, whether it's due to injury, tendonitis, just overuse from training, or for people just going to work every day, sitting at a computer. We'll see quite a bit of shoulder or elbow or even wrist and hand pain, and we have a lot of treatments available to those patients to try to help them out. Another, in the lower extremities, another common thing that we see is knee pain, especially with runners. We'll see a lot of patellofemoral syndrome, or your kneecap doesn't track correctly. And we have quite a bit of treatment options available besides just the traditional ice and rest and cortisone injections and things like that. So if people are looking for a safe alternative, we often allow them to continue to train through their injuries in a safe and effective way. So it's just nice to get the word out to people that we as a sports clinic don't just treat back pain, but we really treat all types of extremity problems and some of the most common injuries and problems that people face on a day-to-day basis.
Now, you mentioned shoulder pain, but you're also a sports clinic, but that shoulder pain doesn't necessarily have to be sports related.
No, kind of one of our little taglines is you don't have to be an athlete to be treated like an athlete. So we like to take the same protocols and principles that we use with our athletes and apply them to everyday life. So sometimes it's just a weekend warriors out there, or the guy that is doing sitting at his desk every day at work, and then he goes out and does a bunch of yard work over the weekend, playing with his kids. And he has aches and pains. We're going to treat those patients just like we would treat our athletes, and try to provide effective results in a very quick and timely manner. One of the great things that I found over my almost 20 years of doing this in treating athletes is you have to produce results with athletes. They're always training. There's always the next big event that they're getting ready for, and they don't give you the luxury of time to address their issues, and they typically want to continue to train through those issues. And so we have been able to take those principles of producing results while you continue to live your life and provide them to everyday patients with really great success in most cases.
What is it that people are doing while they're sitting down at their desk that is possibly causing these shoulder pain in the first place?
Posture is probably the biggest key. As we sit here and talk, over time, what you'll notice is you'll just naturally want to kind of sink forward and round your back. And that posture over time dramatically affects your shoulder and causes impingement issues in the shoulder. And then if you're sitting at a computer and you're typing and you don't have good ergonomics, meaning your keyboard and your mouse are not set up properly, or if your screen is turned to the side and you're constantly looking to the side instead of facing forward, just these things for a few minutes that collect into a few hours, that collect into several days a week over time, start to create these problems. And it's often these silent postural issues that people don't realize are at the root cause of the shoulder pain, and they're trying to figure out, what did I do yesterday or last week to make my shoulder hurt? And it's probably something you're doing every single day of your life. It just doesn't bother you at the moment when you're doing it.
So it's an accumulative type of condition.
Yes, so many of the conditions that we treat are what are called cumulative trauma disorders. It's just repetitive irritation at a low grade level day after day, and it actually produces a lot of scar tissue in your body. Often people think of scar tissue has to come from a surgery or from a big injury. We see way more scar tissue that's due to repetitive microtrauma, and over weeks to months of that repetitive microtrauma, you have the same amount of scar tissue developed as if you would have had a major injury.
And some of these things can happen with just the slightest movements, correct?
Yes, just the wrong movements over and over and over breeds the problems, which is part of the challenge of trying to figure out, why does my pain hurt? It's a very common question we get when we're dealing with a patient that comes in. They don't understand how this happened, and they try to tell you, they'll make comments like, I didn't do anything different, and that's part of the problem. They're not doing anything different. They're sitting a lot, or they might have a job that requires them, they might work in construction, and it's just repetitive lifting and repetitive movement, but it's in awkward postures, and your body gets tired and it gets fatigued, and over time that causes problems in the soft tissues and the joints, and it starts to create issues in the body, and you develop pain.
Is there a protocol that you suggest people do throughout their 8-hour workday or 10-hour workday to break up that monotony?
It's a great question. Probably the simplest thing that we could do is about every 20 minutes change position. So if you sit for a living, if you just stood up, walked around your desk chair and sat back down and worked for another 20 minutes, at the end of your day, you're going to have a fraction of the problems that you have. If you have a job that maybe has you standing all day and you work on a factory, or you work on a line where you're constantly standing, trying to sit every so often, even if it's just for a few minutes or for 20 or 30 seconds, to change the positions and give the tissues a different thing to do so that they're not under the same stress or the same load, it can make a huge difference.
If you have a question for Dr. Mather, use the hashtag AskDrMather on Facebook, Twitter, or on YouTube. Thanks very much.